Anxiety, we all know it, that feeling in your stomach before a big presentation. The worry that keeps you up at night. It's a normal human emotion. But when does anxiety cross the line? When does it become a disorder? Everyone experiences anxiety sometimes. It's our body's natural response to stress. A little anxiety can even be helpful. It can motivate us to study for a test or prepare for a job interview. However, anxiety disorders are different. They are the most common mental illness in the United States. Anxiety disorders involve excessive fear and worry. This fear is persistent and can interfere with daily life. If you are struggling with anxiety that feels overwhelming or uncontrollable, it's important to seek help. You don't have to suffer in silence. Anxiety disorders are not one-size-fits-all. They manifest in different ways. Let's shed light on some common types: generalized anxiety disorder, or GAD. Imagine a constant worry about everyday life, work, family, health. Everything seems overwhelming. That's GAD, panic disorder. Picture this: sudden intense fear that seems to come out of nowhere. Your heart races, you can't breathe, and you might even feel like you're having a heart attack. These are panic attacks, a hallmark of panic disorder. Social anxiety disorder, public speaking, meeting new people, even eating in front of others. These situations can be terrifying for someone with social anxiety disorder. They fear judgment and scrutiny from others. Specific phobias: spiders, heights, enclosed spaces. These are common phobias. People with specific phobias experience intense fear and avoidance of a particular object or situation. Anxiety doesn't just live in our heads, it affects our entire being. It can manifest in physical and emotional ways. Recognizing these signs is the first step towards seeking help. Physical symptoms. Anxiety can feel like a physical illness. You might experience a racing heart, shortness of breath, dizziness, fatigue, muscle tension, or stomach upset. So, emotional symptoms. The emotional toll of anxiety is significant. Excessive worry, fear, restlessness, irritability, and difficulty concentrating are common. You might also experience feelings of dread, apprehension, or impending doom. It's important to remember that everyone experiences anxiety differently. What triggers one person might not trigger another. Section 4. Unraveling the roots of anxiety, nature and nurture. What causes anxiety disorders? It's a complex question with no easy answers. A combination of factors likely plays a role. Genetics research suggests that anxiety disorders can run in families. Your genes might make you more susceptible to developing an anxiety disorder. Brain chemistry. Imbalances in brain chemicals, such as serotonin and norepinephrine, can contribute to anxiety disorders. These chemicals play a role in regulating mood and stress response. Life experiences, traumatic events such as abuse, neglect, or witnessing violence can increase the risk of developing an anxiety disorder. Chronic stress, major life changes, and prolonged exposure to stressful situations can also contribute. Understanding the underlying causes of anxiety disorders is crucial for developing effective treatment plans. Section 5. Navigating the path to recovery, treatment, and hope. The good news is that anxiety disorders are treatable. With the right help and support, you can regain control of your life. Therapy. Talking to a therapist can provide you with coping mechanisms and strategies to manage your anxiety. Cognitive behavioral therapy, or CBT, is particularly effective for anxiety disorders. It helps you identify and change negative thought patterns and behaviors. Medication, antidepressants, and anti-anxiety medications can help regulate brain chemistry and reduce anxiety symptoms. Medication is often used in conjunction with therapy for optimal results. Lifestyle changes. Simple lifestyle changes can make a big difference in managing anxiety. These include regular exercise, a healthy diet, sufficient sleep, stress reduction techniques like yoga or meditation, and avoiding caffeine and alcohol. Section 6. You are not alone reaching out for support. If you're struggling with anxiety, please know that you're not alone. Millions of people experience anxiety disorders, and there is help available. Talk to your doctor or a mental health professional. Remember, seeking help is a sign of strength, not weakness. Take that first step towards recovery. There is hope, and you deserve to live a life free from the grip of anxiety.